Listeria monocytogenes is rarely pathogenic but can cause severe disease in pregnant women, newborns, the elderly, and immunocompromised patients. Mycoplasmas, the smallest free-living microbes, lack cell walls. They are mostly facultative anaerobes. The colonies of most mycoplasms have a fried egg appearance. Mycoplasma pneumoniae is a human pathogen that affects the epithelial cells of the respiratory tract and causes primary atypical pneumonia or walking pneumonia. It does not form fried egg colonies on agar plates. Mycoplasma hominis can cause pelvic inflammatory disease in women. Mycoplasma genitalium and Uroplasma something causes non-gonococcal urethritis. Venereal mycoplasmal diseases can be prevented by abstinence, mutually faithful monogamy, and the proper use of condoms. Corynebacteria diphtheriae, transmitted via respiratory droplets, contain a bacteriophage that codes for diphtheria toxin, which causes the symptoms of the potentially fatal disease diphtheria. Diagnosis results from an immunodeficient assay called an ELK test. Mycobacterium contains mycolic acid in the cell walls. Mycobacterium tuberculosis with a cell wall component called cord factor causes tuberculosis, a lung disease in which the bacteria replicate within macrophages. The tuberculin skin test screens for possible TB exposure. Mycobacterium leprae causes leprosy. Tuberculoid leprosy is a non-progressive form of the disease, whereas lepromatous leprosy results in progressive destruction of body structure. Mycobacterium avium intracellular is an opportunistic pathogen that can become pathogenic in AIDS patients. It adversely affects almost every organ of the body. Propionibacterium Propionibacterium acnes, living in the sebaceous gland of the skin, cause adolescent acne. The bacteria may also infect patients who have intrusive medical devices. Antimicrobial drugs are more effective than topical products in the treatment of acne. Nocardia and actinomycetes are the opportunistic pathogens that have elongated cells resembling fungal hyphae. It is acid-fast because of the presence of mycolic acid in its cell wall. Cutaneous infections may produce mycotomas. Actinomyces is another opportunistic pathogen with elongated cells, but it is not acid-fast. It causes actinomycosis.